Hi, you guys. Welcome back for our daily practice questions. It is day 113, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 26-year-old female presents to the clinic complaining of a fishy vaginal odor and a thin, grayish white discharge. She denies itching or significant irritation. Her symptoms began a few days ago. Which condition is most likely based on her symptoms? Is it A, candidiasis? Is it B, trichomonas? Is it C, bacterial vaginosis? Or is it D, a UTI? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which condition is most likely based on her symptoms, right? So basically, it's asking you for a diagnosis, right? And as I always tell y'all, when they're looking for a diagnosis, you got to run it back and look at those assessment findings. So what are their signs and symptoms? How are they presenting? What's noted on exam, right? So we have a 26-year-old female who comes in complaining of fishy vaginal odor, thin grayish white discharge, no itching or significant irritations. And this started about a few days ago. Y'all, this is classic presentation for CBV, right? So you need to know those key identifiers. If I say fishy vaginal odor, you say BV, right? So make sure you know the key identifiers. Don't miss things that are right there in your face. All right, question number two. You perform a speculum exam on a patient with suspected BV. You collect a vaginal swab and perform a wet mount. You observe clue cells and a positive whiff test. What is the most appropriate diagnosis based on these findings? Is it A, a normal vaginal flora, B, trichomonas, C, bacterial vaginosis, or D, candidiasis? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the most appropriate diagnosis based on these findings? So again, we're looking for a diagnosis, so you need to run it back and look at those assessment findings. So you are performing the exam, right? For somebody who has suspected BV. You get a vaginal swab, you perform a wet mount, and you observe clue cells as well as a positive whiff test. Y'all, this is confirming the suspected diagnosis, right? So it is confirmatory for C, bacterial vaginosis, because remember, one, clue cells is a classic presentation on exam, positive whiff test. pH alteration is also one, greater than 4.5. And so making sure that you know the things and the criteria that fall into these. So when it's provided on exam, you don't miss this. But those key ones, fishy odor, positive whiff tests, clue cells, grayish white discharge, BV, okay? You know my saying. When I say this, you say that. All right, and then lastly, question number three. A 30-year-old non-pregnant patient is diagnosed with BV. She has no drug allergies and prefers oral medication. What is the first line treatment you should prescribe? Is it A, fluconazole, 150 milligrams orally, one dose? B, metronidazole, 500 milligrams orally twice daily for 7 days? C, clindamycin cream, 2%, one application for 7 days? Or is it D, tinidazole, 2 grams orally for a single dose? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here, what is the first line treatment you should prescribe? All right, so we're looking for treatment. I tell you if they're asking for treatment, you need to look and see if they provided you with the diagnosis. If they have not provided you with a diagnosis, you got to go back a step further and look at those assessment findings. But we have to know what it is to be able to treat it. Here, we have on here that the patient has been diagnosed with BV. So, what is first line therapy for BV? It's Flagyl, right? Metronidazole. So, B is your best answer. Also, they told you that she prefers oral medication, so you know we want to stick with the oral medicine. So it also says orally on B, but also knowing generic and brand name, metronidazole and Flagyl. But I always say, Brittany's Brilliance for BV, think fishy, think Flagyl. FF, right? So B is your best answer, metronidazole, 500 milligrams orally twice daily for 7 days. All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.